Well, do you think maybe there's a possibility something was done wrong which allowed these nurses to contract this deadly virus that they should not have contracted?
I don't know.
Is it a possibility?
Sure, it's a possibility.
Okay. So if because there were specific, and given that it's a possibility, and Texas Health has said to the world that they want to act with utmost transparency.
That's correct.
And that they want to be candid with healthcare providers throughout the world about what happened so that they, to the extent possible, can learn lessons from what happened at Texas Presbyterian, right? Correct?
Correct.
So if you're going to help the healthcare community learn how to better care for patients with Ebola, and you believe there's a possibility something went wrong that allowed these two nurses to contract Ebola, then you certainly need to explore what those possibilities are, do you not?
I would agree.
Okay, have you explored those possibilities?
I believe we have.
All right. Tell me everything that you've explored as a possibility as to what allowed the nurses to contract Ebola. And if you're going to object on privilege, is that what you're telling him to do?
I'm not telling you anything that I'm telling Corey to do. We're permitted to consult, aren't we?
Go ahead.
I will object just to the extent that she's calling for you to comment on information gleaned through the root cause analysis. Then I will instruct you to answer that question based on privilege. But
Okay.
otherwise,
Well, let's talk about that root cause analysis. And in your transparency to the world health community, you think you would want to let them know what you think might have gone wrong to allow these nurses to contract Ebola, wouldn't you?
We would.
Okay. And you, being Texas Health Resources, did a root cause analysis, did you not?
We did.
And a root cause analysis is basically investigating to determine to the extent possible what could have gone wrong that allowed Nina Pham and Amber Benson to contract Ebola while they were caring for Thomas Eric Duncan. True?
That's one of the venues by which we looked at it.
Okay. Tell me about the root cause analysis investigation.
again, I'm going to instruct you not to answer that question. If you're asking him to tell you about the root cause analysis, you know that's privileged, and we're going to instruct him not to answer.
They can wait.
Can you answer my question?
I've been instructed by my attorney to not answer that
Now,
based on privilege.
Do you think that's a little bit inconsistent with THR's position that they're going to be transparent about what they found and what went wrong that allowed these nurses to contract Ebola? I think it's a little bit inconsistent for you to say, well, I can't tell you because it's privileged, but I'm going to be transparent. However, I can't be transparent about the very issue that we promised transparency on.
Object to form.
I don't think it's inconsistent at all.
Really?
I don't.
Well, if you're not going to tell the medical community what your root cause analysis investigation found, how are you going to be transparent and educate them on what can be done to prevent this type of tragedy from happening to other nurses?
I think that there's a lot of other evidence we put forward for the community that investigated what we thought happened during the time that Mr. Duncan was in the hospital and subsequent thereto.
So in the effort to be transparent, THR is saying, we'll let you see what the independent experts said, but we're not going to show you what our own investigation revealed. True?
That's correct.
Well, you don't believe it's necessarily true, but we, the public, are never going to be able to see unless the judge orders it what your investigation revealed, because you won't share it with us, correct?
That's correct.
And my question to you is, the people that did the root cause analysis, they were people who actually work at that hospital in part, correct?
That's correct. A lot of THR people on the internal, kind of at the operations level and at the leadership level were involved in that.
So it's not just independent experts such as the one with the expert review. These are people that are aware of THR policies and procedures and actually work in that environment who did the root cause analysis.
They did.
And you can't sit here, or I assume you're not going to be willing to tell me if there was anything different found in the root cause analysis than what was found in the expert panel review, because you won't tell me about the root cause analysis.
That's correct.